Perfect timing. Welcome and good evening. Welcome to the third conversation in our ninth annual Touro University, California Social Justice and Public Health Speaker Series hosted by the Public Health Program. My name is Gail Cummings, and I am the Director of the Public Health Program. I'm joined today by Dr. Deirdre Wilson, who serves as a co-chair for the Community Action for Health Concentration in the MPH program here at Touro University, and together we are hosts of the Social Justice and Public Health series. As a part of our tradition, before we begin each of our talks, we want to pause and reflect and remember that regardless of where we are, where we sit, we are on stolen land. The city of Vallejo, which is where Touro University resides, exists on the ancestral land of unceded territory of the Confederate villages of the Lejeune, the Carquin, the Mawekma, and the Patwin peoples. We also pause to remember that our country is built on the labor of enslaved people who were kidnapped and brought here from the African continent, and recognize the continued contributions of our survivors as well as our ancestors. And we acknowledge all immigrant labor, including voluntary, involuntary, trafficked, forced, and undocumented peoples who have contributed to building this country and continue to serve our labor force. And as we do this work, it is and remains our collective responsibility to pause and critically understand these histories, to repair harm that has impacted generations, and to honor and protect and sustain this land. So if you're joining us for the first time, the purpose of this seminar series is to provide upstream discussions around social justice and public health for students in our MPH programs and professionals in public health, medicine, education, pharmacy, and nursing degree programs, as well as for our community and global partners. Each year, you know that we focus on a different topic, and this year's topic is impacts of technology on health equity and social justice. So over the course of the remaining talks, we will continue to hear from leading experts across diverse fields of public health policy, technoscience, law, and social justice, who will help us understand the current technology landscape with discussions centered around how it's developed, how it's deployed, and regulated, both of which can promote as well as undermine social justice and health equity. We've been so fortunate to continue bringing really remarkable speakers to our series over the last 8 years. And for this series, we started off with Dr. Ruha Benjamin, who provided a groundbreaking analysis for us on race and technology. She was followed by Molly Turner, who talked about the intersections of technology, urban life, and the built environment, both conversations centering firmly in health equity and social justice. We are super excited for today's speaker, Maya Wiley, who will dive a little deeper into these issues with a conversation on the digital divide as a social determinant of health, based on her rich experiences in advocacy and civil rights. But before we get to Ms. Wiley, I'd like to turn it over to Dr. Deirdre Wilson, who will cover some housekeeping details, and we'll go on to introduce Ms. Wiley. Thank you.
I'd like to remind you that we are recording, and here's our Zoom policy. And Dr. Cummings has already provided the land and labor acknowledgements. The roadmap for this evening, there will be a presentation by Maya Wiley, followed by a discussion and Q&A. If you're interested in asking any questions, please submit those questions in the Q&A function of the webinar. There are several continuing education opportunities. There's continuing medical education, and that information will be in the chat function. The activity code for the continuing medical education is here, 09CREW. And again, this information will be posted in the chat function. We also have social justice badges and a micro-credential available for the Social Justice Speaker Series and other workforce development opportunities within the public health program. So please follow the links again in the chat. And last but not least, the Socially Just podcast will provide an overview of all of the sessions that we've done over the last 2 years. The next episodes or the next season of our podcast will air in the spring of 2024. Now I'd like to introduce Maya Wiley. Many of you may have already heard or seen Maya Wiley on several different news broadcasts, but she is a powerhouse in her own right. She is a nationally renowned expert on racial justice and equity. She has litigated, lobbied the U.S. Congress, and developed programs to transform structural racism in the U.S. and in South Africa. Ms. Wiley is currently the Senior Vice President for Social Justice at the New School University and the Henry Cohen Professor of Public and Urban Policy at the New School's Milano School of Management, Policy, and Environment. She is an expert on digital equity and founded and co-directs the New School's Digital Equity Laboratory. She is the co-chair of the New York City Department of Education School Diversity Working Group, formulating recommendations on school desegregation. Ms. Wiley is the former chair of the New York City Civilian Complaint Review Board, the country's largest and oldest independent oversight agency on police misconduct by officers in the New York City Police Department, New York Police Department. Prior to that, she served as counsel to the Mayor Bill DeBlasio of the city of New York from 2014 to 2016. As the mayor's chief legal advisor and a member of his senior cabinet, Wiley was placed at the helm of the mayor's commitment to expanding affordable broadband access across New York City, advancing civil and human rights and gender equity, and increasing the effectiveness of the city's support for minority and women-owned business enterprises. Ms. Wiley has been a powerhouse in her work on equity, justice, and civil rights, numerous initiatives with organizations such as the Open Society Foundation, the NAACP Legal Defense, and the American Civil Liberties Union. Ms. Wiley is also a legal analyst for NBC News and MSNBC, has written numerous opinion editorials for major news outlets, including The Guardian, Time, and Essence, Fast Company, and the New York Daily News. In 2018, Ms. Wiley has been named, or was named, one of the world's top 100 leaders in digital government by Apolitical. So obviously, Ms. Wiley is more than qualified to teach us about the intersections between public health, health outcomes, and the digital divide. We welcome Ms. Wiley as she provides the talk for this evening. Thank you.
Well, thank you. I want to, sorry, just pulling this up. I am so grateful to be with you, Dr. Cummings. Thank you, Dr. Wilson. And thank you to all that have joined this presentation. And I hope we will be able to the extent that we can on a technological platform, have a discussion. And I will start with one correction, which is more of an update. All that was true, except that I am now the president and CEO of the Leadership Conference on Civil and Human Rights, which is the nation's oldest and largest civil rights coalition in the country. We work on everything and every issue, which is one of the reasons why I'm very privileged to lead it. We do that in coalition that looks like this country, that looks like many of the communities we worry about when we talk about social determinants of health. And we work on every issue that is related to the social determinants of health, which I have always found to be a really powerful framework for understanding how to create a just and equal society as opposed to an inequitable one. So I will say that. I will also share a little bit of my background and how I got to these issues, because if you leave here tonight with anything, anything at all of value, I hope what you will leave with is a strong sense of your ability to weigh in, disrupt, interrupt inequality in all its forms, but in particular to know that to understand technology in the context of social determinants of health, you do not need to be an expert in technology, which is part of why I'll share some of my journey with you. So I'll start with a little bit of that journey just because it'll help you understand where I'm coming from, how I've gotten to this discussion, how I got into digital equity work in the first place, because I am a generalist. I am an expert in nothing, except to the extent that I'm an expert in racial justice and how to work on and the policy fixes to inequality. But that means everything. That means every issue, because people don't live single issue lives. And I came to civil rights work. One of my earliest positions was at the NAACP Legal Defense Fund. I was a litigator there. Well, actually, even before that, at Columbia Law School, I worked for the AIDS Discrimination Law Clinic, in which we were working. It was the first of its kind in the country. It's when AIDS was its own, essentially, pandemic pre-COVID. It was one in which we stereotyped people. It was one in which there was a huge amount of discrimination, both in employment and in healthcare, for people who were either HIV positive or who people believed might be HIV positive. You didn't even have to be HIV positive. But that was kind of my introduction to issues of discrimination in healthcare as a law student. And when I went to the Legal Defense Fund and worked in the Poverty and Justice Unit, because I always wanted to work at how do we break down this thing called poverty and the fact that people of color, Black people, but people of all races are of color are disproportionately likely to be poor, because that's a construct unto itself. That's not a natural condition. If the world was just fair and right, we wouldn't see disparity. So we always talked about and looked at disparities, like healthcare disparities, as a symptom of a deeper problem. So I did access to healthcare work, including litigation and including lobbying the US Congress when Bill Clinton was president. We thought we were going to have national healthcare reform. But that's not actually how I got to the technology work. I got to the technology work because after I founded my own organization called the Center for Social Inclusion, we had Black leaders in South Carolina saying to us, we may be poor, but we have land. We have an asset. And we have a country that's talking about climate change. We have a country that's talking about how to do green jobs and green economy. Well, why shouldn't we be able to create a better economic future, more prosperity for our community, but do it in the green economy, utilizing our land? So we thought, okay, this is why we're here. This is why I founded the Center for Social Inclusion, which was to work with communities of color to figure out what would get them the kind of future they wanted for themselves, with them, not for them, with them. And with communities themselves understanding their assets. And here was a perfect example of a Black community. 72% of that Black community, Lower Richland County and South Carolina, right outside of Columbia, South Carolina. And they said 72% land ownership. That was higher than the national average, even for people who were white. So they were right. But then the question became, what do they do? Anyway, long story short is we started talking about pulling together a group of experts, figuring out what ideas would help them turn that land into prosperity, into economic opportunity, so that they had a better future, their kids had a better future. And one of the people had a friend who was a real estate developer, but did green real estate development, was from Mississippi, understood the Black Belt South. He was one of my experts. He used to do his building developments were green. His building developments always thought about where and how do you get more jobs related to what development we're doing. Really, really broad thinker, really interesting thinker. And he said, well, you got to invite this other guy. He's a friend of mine, old friend of mine. You got to invite him. And I said, okay, I'm happy to invite him because you say so, but what does he do again? And he said, well, he's a technology engineer. He's a tech guy. And I said, and this was in 2000, this was the early 2000s, mid 2000s. And I was like, okay, I don't understand why I need a tech guy. And he said, his answer was, neither do I, you just need him. And I said, okay, let him come. He was also Black. We had a hour and a half long conversation. It was fascinating about what kind of development might be possible, what would make it green, what would ensure that people were healthy and more prosperous in utilizing this land for this economic development in this Black community, that the reason they even had that high of land ownership, by the way, was because when the Union Army came through, kicked all the plantation owners off the plantation, turned the plantations over to the former slaves that they had just freed. That's how they got all that land ownership. That's its own unique history, which is why it is unique that their land ownership is so high. But I say all that because we're having this fascinating discussion. So you can imagine how fascinating it is. And this tech engineer guy has said absolutely nothing for the whole hour and a half. And at the end of the hour and a half, he stands up. His name, by the way, is Bruce Lincoln. He now runs an organization called Silicon Harlem. So Bruce stands up and he says, okay, well, I got to go. But I just want to say one thing before I do. Y'all can't do any of this shit without broadband. And then he left. And I just sat there stunned, going, huh? We've been talking for an hour and a half, generating all these fascinating ideas about what kind of crops they could grow that would be green crops that then would contribute to renewable energy, all these other things. And his answer was, don't matter. Because if you don't have broadband, none of the things you want to do in this green economy is going to happen. And that's when that was the lightning bulb right there. As someone who was always trying to figure out solutions, expert nothing, but always thinking structurally, which is what social determinants of health is. It is structural thinking. He basically said, you're missing a critical piece of the determination of how to get to determination, of what means that people don't have determination right now. And I thought, that's it. We got to work on broadband. And the more we dug into it after that, we started to realize, yeah, this is electricity. This is water. This is land ownership. This is basic. You don't have this. You don't have any of the other things you need for all of the solutions we want to drive. Now, that's my story. I won't go through my whole resume about all the things I did with that learning, but I do want to go, and I am going to do a screen share because I'm not going to do a whole PowerPoint presentation, but I do have some slides. Sorry, one second. Let me get this up. But I do think it's critical that we actually talk about what social determinants are from this vantage point. And there's really nothing very surprising here except my ability to advance my slides, which may be a little surprising. Okay, let's go. So I always think, and I think of social determinants in this way, but I actually think of doing work, all the work we want to do to make people's lives better, to make them more fair and more just. We have to start with the power of the better question. And, essentially Bruce in that conversation was pointing to us, you all aren't asking all the right questions about what people have, about what people need to get to where you want to go. But this is a structure for this talk. So when we're talking about the power of the better question, really underneath that are three questions. It's, why does it matter? Why is the thing we're talking about, why does it matter? And the second is, what does it mean? What does it mean that this thing that matters is what we want to do? And what should we choose? Meaning, what should we do about it? And this has been a really helpful framework for me in so many ways. But in a way, and let's go to social determinants of health, right? I don't know how you all have talked about it in your previous sessions, but this is from the World Health Organization. If you went online and searched for definitions of social determinants of health or images to say, what is it? What does it look like? this is typically the kind of thing you will get up. It's very common, including all the elements of social determinants, right? Education and its quality, healthcare and its quality, how the neighborhood looks, how it's built, what the built environment is, what's the social and community context, is there economic stability? These are usually the big bucket questions. And obviously within each of these buckets, there's a lot of stuff that is part of the very real lived experience of people, of communities, of what's in it. When I was working on what we call structural racism was another way to talk about social determinants of health. And we used to put housing right in the center of a similar diagram, because where you live drives so much about what do your schools look like? What does the quality of your healthcare look like? Do you even have healthcare in your neighborhood? My case as a litigator was around hospital closings in low-income communities of color. There's a reason why certain communities have a lot of healthcare facilities, doctors in them, and a lot of others don't. The quality of housing, whether your housing's overcrowded, whether you have heat and hot water, whether or not you have asbestos or lead paint, all of these. My client in my hospital closure case had more children than she could feed. She had 8 children. Her husband worked construction. They went hungry every day. And the last hospital where she had her babies was trying to move maternal and child care services out of the community. Many of her children had lead paint poisoning because they had lead paint in their very, very crumbly, inadequate apartment that was also too small for them. Could go down the list, right? These are all what we mean by social determinants. All these things matter. And depending on where you live, whether you can afford to live in a place that has all the things you need or whether you can't, that is central to social determinants, right? And why we see racial inequity, why we see more Black people, more people who are Latino, who are immigrants, more people who are Native American, Indigenous. This is why we see that so often, is because people can't afford to live except in communities that don't have these things, where the housing's cheaper. And often there's also housing discrimination. So this is a framework, this social determinants is a framework we use as civil rights leaders and activists to talk about structural racism. But then you should be saying to me, well, Maya, but okay, where does technology fit? Does it need its own bubble? And the short answer is, it's all through every last one of these. So you could give it its own, but if you really think about what technology is, what it represents, that's why I'm saying it's like electricity. It's like water. Now, you can't imagine any human being healthy without water. Maybe they could live without electricity. Wouldn't be easy, but they certainly would have some inability to get some basic life things done, particularly now in a technology-driven society where you need to be able to plug in your equipment. But my point is, and we can talk a little bit about this in a minute, but let's just take COVID. Let's just take COVID. You want to talk about technology and social determinants of health. What did we see in COVID? Right? We saw many people fortunate, the ones who were fortunate enough not to lose their job. How were they able to stay working? We're on a Zoom right now, and Zoom became a verb, right? It's actually a company. It became a verb because it became the primary tool that was available, Microsoft Teams, but all technological tools from tech companies that enabled us to find ways to still meet, still transact, still sell, and still do things that helped us keep going in the economy. And for those of us lucky enough, keep our jobs. We were still able to have meetings. We were still able to do work. We were still able to share work. We were still able to be in touch with folks. For far too many, they didn't necessarily have that ability, or their jobs, right, required them to physically be in place. Remember who essential workers were. healthcare workers, but also people who worked in grocery stores, people who drove buses, people who are in law enforcement, people who are firefighters, all the people who were considered essential were also the ones put more at health risk. And without being in job markets where they had the privilege of being able to work in the safety of their own homes, they were also more likely to get sick. And it's why we saw so many, particularly people of color, get sick from COVID and die in disproportionate numbers because of the social determinants, but also they didn't have the privilege of choice about what kind of job they would have and whether it put them in harm's way or not. But schools is really one we all talk about a lot, right? And so many, I bet many of you on Zoom experience this both because you're students. This kind of learning that we're doing right now was something that was less common before COVID. There were online courses, but they were courses by choice. And they were, sorry, speaking of technology, just making sure my recording is functioning. But that this was the experience of parents and students and our children and college students. I had a high school student and a college student when COVID hit. My family, we had internet access. We had computers. We each had a laptop. Each one of us had a laptop and a cell phone, right? Because we're fortunate. We have good paying jobs. We have the ability to pay, frankly, too much money for only marginally adequate internet access. I say that because of how we've created the internet. It was a pain sometimes because if too many of us were all on at once, might disrupt our signal. We were still better off than far too many people. And then people with young kids, right? Or people in overcrowded housing, where even if they were lucky enough to have a laptop, even if they were lucky enough to have a smartphone that they could utilize to get online for school. And a lot of schools we know were scrambling to get donations of laptops. Cities like the city of New York wasn't the only one, scrambling to buy and also get donations of laptops and tablets to get into the hands of low-income families in order that they could actually get online and participate in online learning during those many, many months where students were not going back to the classroom. And teachers, of course, needed them. But we also found that there were many people who were in overcrowded housing conditions, so that even if they were lucky enough to have the internet service, the laptop or the tablet, they often had the problem of where and how they could concentrate, even just concentrate on online learning, because too many people might have been in one room all trying to do online learning. And maybe they didn't have headsets so that they could hear and listen without disturbing other people in their household. We know particularly for Black and Latino children in particular, the learning loss, and I know a lot of educators say don't use that term because, but the way in which it impacted students' learning was pronounced. The research even before online learning because of COVID was that online learning was less effective for many Black and Latino students. Lots of reasons people think that may be, but at any rate, that was true. We have seen since COVID, as more and more research is coming out, it was Black and Latino students and probably Native American, not as much data for Native American populations. Asian probably as well. We don't break up the data and collect enough data by all the groups that we should be tracking and paying attention to. Students with disabilities of any race. And then if you were a student of color who also had a learning disability, you had the double whammy of the way in which online learning did not serve you. But the technologies made a difference in how well or not well you had the opportunity. But it wasn't just the technology, right? It was whether or not you had the internet at home, whether you were ready and able to get up and use that technology and know how to navigate it. I had colleagues, highly educated, advanced degrees, tons of what we call digital literacy. They actually know how this stuff works. They worked it at work for themselves. But the number of hours they spent at home toggling between their own work and supporting their children, navigating online learning, figuring out how to utilize the curricula. I mean, think about it. You have a kindergartner. You have to kind of help them through their assignments. Well, a lot of low-income families, either they couldn't do it because they were not able to speak English, so there were English language access issues. There were families that because the parents still had to work, they couldn't sit side by side with their kids and help them through it. There were some children who were older, so they were not paying attention to their own lessons to help their younger siblings figure out how to learn with their lessons. These are real life stories. And a lot of it is also about the fact that even with the technologies, there's how much ability have you had to utilize it? How much, what is your family resources and how you can utilize it just to get the basic education you were supposed to be getting, right? And then we saw, and there's some research that shows the social and emotional learning, of course, for children, no matter who the children were, you know, even higher income children had social and emotional issues during COVID. It was a highly stressful time. But if you were a student of color, you were more likely to have experienced a death in your family due to COVID. You were much more likely to have extreme economic hardship because of COVID. If you were in an undocumented immigrant family, remember, all that COVID relief, you weren't eligible for it. So the fear of eviction, all of the stressors, the fear of family life. I was talking to a woman, undocumented. She was one of the lucky ones because there was a community-based program. She had school-age children. The community-based program was across the street from her public housing, the housing she was in East Harlem. But the point is, they didn't have enough mattresses for family members to sleep on. Now think about that and think about a kid trying to figure out how to learn online. And they were terrified constantly because they had family members who would have to leave the apartment to go work, and they desperately needed them to work because they weren't eligible for any of the COVID relief money. And then coming home, and they were stressed about whether they were infecting their families, and it's a 2-room apartment with 8 people in it. That's social determinants of health. And even so the technology issue in that is, even when cities did a good job of getting kids an internet access and a little Wi-Fi box or other hotspot that they could use in their apartment, even though they didn't have internet access before COVID, all these things were significant social determinants of that were going to create poor health, and did before COVID, exacerbated by COVID, but demonstrated better to have the technology than not, and far too many did not have it. In fact, if we were to look at the data on who had access, smartphone access, we talk about how we've closed the digital divide because we typically only think about the digital divide is whether you have internet access and whether you have a device upon which you can get on the internet. Well, we now have 97% of the population has a smartphone and access the internet through that smartphone. So then a lot of people say, well, so we've closed the digital divide. Well, think about COVID. Number one, it exposed the myth of that because, of course, you can't have the privilege of a job where you can stay safer in your home if that's your technology and the only way you can use it. Because all of the other social determinants and whether you have the privilege of a safer job. But the other is even just the ability, try to do your homework on a smartphone. Try to follow 7 hours of coursework on a smartphone. It is not the smartphone that closes the digital divide, although it is an incredibly important tool. And if you're that $30,000 or less, if you're a household earning $30,000 less, much more likely that your main source of internet access is your smartphone. And the other thing is, that's not 100% access 100% of the time, because usually you have data plans and they cost. So can I afford an unlimited data plan? Do my kids have smartphones with unlimited data plans? Yes. Too many people who were talking about during COVID, and that certainly that category of folks who are more likely to get infected, more likely to possibly die from being infected, more likely to be struggling just to eat, more likely to be on an eviction list, more likely to have children struggling in school because they didn't have the right access to the resources and services they needed, let alone the technology or help utilizing the technology. All of those folks, smartphone doesn't solve those problems, even though it creates a statistic that helps say that we're closing the digital divide. Let's talk about then even accessing healthcare itself. And I do want to share this. This is from the Pew Research Center, which has done for years a lot of surveying of people on their use of technology, how they use it. And during the coronavirus outbreak, obviously, no surprise, they found that 90% of those they surveyed said the internet was essential to them for getting through the outbreak, for all the things they needed to do. 81% said, 81 say they have talked to others. They were using the video calls, and it was one of the ways they could connect to people. That connection to people is important for mental health. It's also important for information. It's important for a whole bunch of reasons. 40% said they use digital technology or the internet in a new or different way compared to pre-COVID. And we are still experiencing that. We are still using technology to communicate significantly more now than we did even before COVID. And we were using it a lot even during COVID. And people have been honest about the struggles, that they also were struggling. 81% of US adults talked with others via video calls, right, since the outbreak. 40% say they were often or sometimes feeling worn out or fatigued from their time online. I mean, we don't often talk enough about how too much technology is also bad for our health sometimes, including if we're being too sedentary, including if we're feeling too isolated, getting depressed. Depression was a huge issue during COVID, as we know. In fact, it's dang near possible to get a therapist even still because they're all so booked up. Many people are using online services to get access to healthcare, from mental health and to other forms of telehealth. But just the vast amount of technological use required has had an impact on health. 33% say that they've tried to cut back on the amount of time they're spending on the internet. And 26% say they were worried a lot about the high cost of that internet. And that takes us back to the economic stress of trying to keep up with the technology that has become so essential. With 60% of broadband users with lower incomes talking about connection problems, talking about worrying about their ability to pay for those connections, because they have become lifelines, because you need technology even just to apply for a job now. You try to get even a service job, like my kids trying to get jobs as college students. They don't just show up at the store that they want to work behind a cash register at. They got to go online and fill it out. You want to pump gas at a gas station? A lot of that is online. You got to go online to fill out the application. And as I said, so that's even for service jobs that are not high tech, right? That don't require a lot of high tech know-how. And I think that might be I think I did not use the other slide, and I'm going to stop my sharing now because there was another slide and I took it out right? I'm saying all this because we talked about the power of the better question. So one reason I shared all of that was to say, because you all know it, right? It's to humanize the very experience that you all, I have no doubt that all of you could relate to something I shared. Because even me in my privileged income bracket, I can appreciate just how much I need this technology. I can appreciate just how hard it was for my own family during COVID, despite the luxury of my technology, and just how hard it was if it wasn't working, but also the mental health issues associated, all those things. I mean, and watching the stress levels that the technology, not just the isolation, but just how necessary it is even just to transact in this economy. So, that context, the power of the better question to me in the context of the social determinants of health, as it relates to the digital divide, as it relates to all the things that I've just been talking about and that I appreciate seeing in the chat, others saying I can relate, is this. The question, I think, an obvious question becomes then, well, I just talked a lot about why technology matters, right? But I think the better question isn't why does technology matter? It's because technology is a tool, and it's a tool that can be used, as we just talked about, that helps us, like, stay connected to our jobs, stay connected to our loved ones, even when it's too dangerous for us to go see them, have the ability. We'll talk a little bit more about the applications now that are available because of technology. We'll talk a little more about artificial intelligence, because that's technology too. Like, they have the potential to be really useful. So certainly you'd rather have a laptop and a smartphone and an internet connection than not. Because if you don't have them, it is too hard to get what you need. It is too hard to get a good job. It is too hard to get a good education. It is too hard to do too many things, and it has the ability to bring you some more resources, some more help. But it can also do harm, as we talked about with the mental health issues, with the sedentariness. We could talk about the mental health decline of our adolescents on social media. We have the incredible mushrooming on social media, for example, which is technology. That is a different kind of community, right? When we traditionally used to talk about the social determinants of health, we didn't talk about online communities. But online communities are now part of that community fabric in that social determinants diagram that are impacting health, including mental health. There is sex trafficking of young people. There is all kinds of ways in which young people are seeing content not that only that damages their mental health, but in some instances becomes victimizing to them. The getting images and the deep fakes out of artificial intelligence are now being utilized to blackmail people into performing sex acts, pornography, in exchange for keeping their identity hidden. That includes children. So I say all that to say, the tool that technology can be positive or harmful. So in my view, the better question, the power of the better question, which is, how do we have a healthy society? How do we have a society where everybody gets what they need? Gets what they need so that their health is better before getting sick, so that they're less likely to get an illness or a mental health condition, and that they're more able to get the access to the kinds of healthcare and services they need if they do have health problems. They're more likely to get it identified and diagnosed, for example. But those social determinants of health are the conditions that we need to keep people healthy. And we have to start factoring in technology as one of the components that can weigh either towards health or not towards health. But it's also a symptom, because the reason communities of color and rural communities, the slide I'm not showing, which is what I wanted to get to, the why does it matter? And so we've talked also about, what does it mean? We know what technology means. It means everything's changing around us. It means we have a tool to help us do a lot of things that we need to do, but it also causes some harm. So we know it means what we decide as a society it's going to mean. Because it's a tool means we have the opportunity to make different decisions about it. But I say that because when you go back to that social determinants framework, right? Whether it's education, whether it's housing, built environment, physical environment, whether it's healthcare and health access, whether it's, society, social and community, all of those things that are in that diagram, they're the same thing. They're constructs. We decided, well, not all of us, we all didn't have equal decision-making power, but we made decisions as a society about what kind of housing we were going to have, how it was going to get built. We have private housing that's luxury housing. We have basically a private housing market, except for public housing. And in some jurisdictions like New York, rent regulated, where you try to keep things affordable by creating programs to incentivize landlords to keep it affordable. But in all of those decisions, we created a healthcare system where we didn't choose to have a universal and national healthcare system like some countries in Europe. We chose to have a privately driven healthcare system with some public health insurance programs and now health exchanges. But I'm just saying all that because they were policy choices. But every single one of those policy choices, we made the same type of choices around technology. So we have driven technology as essentially a private sector, privately driven resource. And what that means is everything from we've made it expensive. We don't necessarily get the best quality. And it means if you're low income, and whether you're rural or urban, if you're in rural areas, you're less likely to get it because the companies, the cost of them delivering the service is just of laying the pipe. Building the infrastructure is more expensive than what they feel they can charge a community for the service. The dollars and cents just don't work. One of the reasons I didn't, now I should have shown it because I've been talking about it so much, but it was a slide. It's a recent study. Purdue did it. So it's really interesting, but it's by county. It shows digital divide by county. So they've rated counties high digital divide or low digital divide. And I decided not to show it, but one of the reasons is because what's the power of the better question also has a flip side, which is the power of unintended decisions from not providing all of the right answers. So in this county, and they acknowledge it, this isn't about Purdue, they acknowledge it in their write-up. But the graph itself, what they say is, well, and I'll just read you the statistic, like 70 in the high digital divide, meaning a lot of people don't have what they need to get online, whether it's internet access at home and usually internet access and a device. Like 71% of the high digital divide counties are rural. And then a very small percentage, and then a very large percentage of the of the low digital divide, meaning much more equal, many more people have access to the internet and to the device, are in urban areas. Now, if you just looked at that and didn't ask another question, what you would say is, okay, it's a rural-urban problem. So urban's fine, rural's not. Well, rural is not fine. There's no question about that. But here's the thing. If you went down to census block, right, instead of just looking at county level, because what you will find is racial disparity and economic disparity and education level disparity and also age disparity. So the older you are, if you're over 65, you're much less likely than if you're 18 to 34, right? But if you're a person of color, you're much less likely to have both internet access at home and a device in an urban area as well as in a rural area. And a lot of that goes back to those other social determinants. So I'll give you an example that it's a New York example, and I should be paying a little bit of attention to time because I want to make sure we have a chance to have some exchange, because I could go on for a very long time. But in an urban area, when we build housing, you know, the older the housing stock, the less likely it was to have the technology, the cable laid in the building or under the ground to provide broadband access, the better technology that we have these days. What they got was phone lines, and then they would run internet over the phone lines. Remember, for those of you who will remember with me when we first got the internet, you might remember the modems and the phone lines, the DSL lines. Well, you know what? Newer housing, they build that technology right into it. But what that means is low-income people are much more likely to be in old housing stock. So the places where the technology did not get laid. And so then the private companies started skipping them over as more and more technological upgrades got created, including when we got to broadband, because it was so much more expensive to upgrade the infrastructure. So it's inequity gets layered on top of inequity, gets layered on top of inequity. So you can go from housing and housing segregation, then the quality of that housing, and then the technology on top of it. And that's just one example. And it's a big reason why in urban areas, there's less good access if you're a person of color, because you're probably in an older community, you probably have older housing stock, but it's also the cost. So let me say one last thing, because then I want to open it up because I think I've been talking for too long. So here's the thing about now we're also in the whole new world, because the thing about tech is it's constantly leapfrogging, right? So now we're in this world of tech where it's like the new is artificial intelligence. Artificial intelligence itself is not new, by the way, but generative artificial intelligence and all the possibilities of what it can create. Well, just like all of that other technology we've been talking about, can be good, can be harmful. And let me give you an example of how even artificial intelligence can layer on top. So, and I'm just going to give one example. So there was a study, artificial intelligence, a company using artificial intelligence decides it's going to help create a tool for hospitals. And this tool is going to be, to help hospitals understand who is more likely to need hospitalization services. And this is obviously useful for healthcare administration, and for meeting people's needs and anticipating who's going to need them and planning. Here's the thing. Guess what data they used? Because one of the things AI is actually a general term. There's a lot of things that fall into the category of AI. But often what we're talking about is these models that scrape tons of data and then create an algorithm, a computer-generated algorithm to make understanding of that massive amount of data to then draw conclusions. And that's what this did. And it had 200 million different patient admits and data points that made up the basis of this algorithm and the conclusions it draw. So guess what it found? It found that the people who needed hospitalization the most were much more likely to be white, have health insurance, and be higher income. Why do you think that is? It's the problem of not asking the better question. Because why does it matter? Why does it matter who needs hospitalizations? It matters because we want to make sure people who need it get it. So what does the data mean? When the data you are scraping is the data of people who already have the privilege of, one, health insurance, and two, hospitals and hospitalization. What does it mean? It means you're capturing privilege and ignoring inequity. And then what do you choose? Do you choose to use that data or understand that that can't be right? Fortunately, it was very clear to everyone that can't be right. Flew in the face of all kinds of other. But that's just an example of how when you're building your knowledge base off of a divide that it long precedes it, not to mention some of the health issues and privacy issues related to healthcare data, we've got a lot of questions about how we do this right. And so what we should choose always is to make sure that we're asking the better question, which is always, who is most marginalized? Because if we're taking care of those folks, we're taking care of everybody. We're making it better for everybody. So I would argue that's the better question. The what does it matter is because if we want this society to work for everyone, if we want everyone to be healthy, if we want everyone to get what they need, we got to understand the least of us to make sure it's all of us. And, then what do we choose? We choose equity. We choose to understand what's underneath the symptom. So we don't just treat the symptom. We understand what created the symptom in the first place. That's a health framework, but that's a social determinants framework. That's a racial justice framework. That's a solutions framework. That's a better society framework. And I will stop there and open it up for questions and apologize for talking so dang long.
Don't apologize. It was very enlightening, and it gives us a lot to think about. And just like a couple of people commented in the chat, not only can we relate, and I can actually relate to dial-up, but I think that it gives us, when you made the analogy of water and electricity, I think kind of that it was really an aha moment for all of us, and so. I'd like to open up by asking questions about how can we actually mandate that equal access kind of across all of these communities. What kind of policies can we put in place at the state and federal level? How can we put those policies in place to make sure everyone has access, similar to kind of the state, county, federal mandates for both water and power? Right, yep. That were put in place over time. And I think that we're now seeing that access to the internet and other digital resources are becoming as essential as water and power.
So there's both good news and bad news. The good news is, the good news is we have taken some of those steps. The bad news is we haven't taken enough of them, but that's news. We can make our own news, and that's what we need to do. And that's why we have advocacy. We have to all understand these issues and not let anyone tell us we have to be an expert to understand them, because we don't. We just have to have experienced it. But the short answer, the Biden administration has just done this. Congress just did this. Coming out of COVID, because of all the experiences, even though the digital divide wasn't new, and the Obama administration before had also, coming out of the big recession, the Great Recession, pumped a lot of money in creating things like community computer centers, pumped some money into other kinds of community-based programs, but also pumped some money into trying to increase access to the infrastructure. So that was a good step. It wasn't as much as we needed. It was still very much private model for the most part on the infrastructure, but it did create some community assets and resources on getting online. The other was the Biden administration has just created and with Congress, a really important subsidy program that is subsidizing internet access, high-speed broadband internet access, so that you don't have to pay more than $30 a month for it. Now, if you're very low income, that's not low enough. But that helps a lot of people because in the US, the average monthly access was $60. So having a subsidy program, a federal subsidy program that lowers that cost means more people can be online and can be online better, can be online at home. Some of the things that we need to keep pushing for is more public programs. So for instance, when I was counsel to Mayor Bill DeBlasio, we were looking at, well, what can the city do to think about our resources to create free access? And so some of that was trying to create free public hotspots, not as good as home-based internet, but if you're on a pay-to-play plan, you don't have the money, you struggle to pay for your data through the month, but you can go around the city and get off your data plan and get free internet here and there. You're also saving money on your data plan. That lets you go get a little bit farther at home. Other cities were doing similar things, but also trying to put free broadband access into public housing. So we subsidized, I basically, we looked for the money out of the city budget to put towards actually paying for apartments within public housing to get free service. So that's a public sector strategy, right? So I think what we need to think about is state government, local government, and federal government as a better partner on some of the ways to help these happen, to really create some public programming around access. It can't just be private sector because private sector is always going to be too expensive for low-income people. And we have to make sure that your paycheck doesn't determine whether or not you can get online.
A few questions from our attendees. And so the first is, how does social justice and public health impact your future as a citizen or a health professional? And, so I'm assuming that this is with regards to kind of the social divide and how we can make sure that we are addressing social justice in the distribution of or equity in access.
It's such a good question, and a whole PhD dissertation can be written on this. But the short answer, I think, is a couple of things. We have to have a framework and a set of principles that says this is a necessity. Everybody has to get it, and everybody has to be protected in using it. So this is where privacy matters. This is where making sure artificial intelligence isn't weaponized. We're already seeing that. So for instance, in employment, there's job loss and sectors of job loss. So we need investment in people's ability, workforce development programs, so people can still take care of themselves and their families in an economy that's going to shift because of technology. That doesn't mean everyone has to be an expert in technology and get a tech job, but it does mean understanding that there's certain markets, there's certain job markets that are going to be impacted by this. And we got to make sure all our people have the ability to get the support and skills they need to be able to get work that is going to be created, frankly, in a new and transforming economy because of artificial intelligence. But it's also the protection side, right? We do need to have rules of the road that says, that that people have privacy and privacy protections. Right now, we have a model in which people's data is making great wealth for private companies, but putting them at risk with, as I said, bias in predictive algorithms. I just gave you the one example of that algorithm that was just going to advance disparities if anyone didn't realize that was just not the way the world was working. So we're actually working at the Leadership Conference on Civil and Human Rights. We have created a Center for Civil Rights and Technology, and as a coalition, we're working on the kinds of protections you need to have. By the way, that's at state and local level too, not just federally. That says your privacy is your privacy. You should have some sovereignty over your data. It can't be used to discriminate against you. Surveillance is a huge issue. We shouldn't have Amazons. I don't know if you've been following this news, but Amazon is a great example of not only a company that's union busting, which I would argue is not social justice, but that's also, the labor conditions are so bad in Amazon workhouses. I'm calling them their warehouses, workhouses, but it's actually a good word for them, where people they literally have artificial intelligence management surveillance on the work floor, machines deciding if they're taking too many breaks or not working hard enough. And it was already an environment even before that where the productivity requirements are so high that people can't take bathroom breaks, that people urinate in bottles. That's how bad it is. And so I'm saying that because we also have to have labor protections for basic human dignity, because the technology itself is even changing the conditions of work. And so all of that is to say, we really and are actively doing it at the leadership conference in coalition. That means a coalition, lots of organizations, labor, including labor unions. And we all have to work with this principle of our data sovereignty, our well-being, our workforce and labor protections and investments, and investing in people and making sure they have their basic needs met. All those are critical principles.
Wow. Yeah, you've given us so much to reflect and chew on, Maya, and just your last comment just kind of ties some of the dots together from your conversation when you said, understanding the least of us as the framework, you really for social justice and these social determinants, that's, critical to everything that we do and how we should be moving forward. And I know there's so many issues within that box, as you mentioned it. I'm wondering, what are some of the innovative solutions? I know we've talked about the, state and federal government and even private industry. What have some communities been working on that you can touch on?
Yeah, well, first of all, and a great model that came out of Detroit, and then it got replicated here in Brooklyn, was the digital stewards. And I love this model because it was two things. One, it was young people in communities of color in parts of Detroit and in Brooklyn, but trying to figure out how to expand it, who were learning how to create their own community-based Wi-Fi networks. And by learning that and actually putting up that infrastructure and maintaining it, and the reason they were digital stewards is they weren't just learning how to build the infrastructure for wireless broadband in their neighborhoods, which is it's much cheaper model. They then became the stewards to their community to help their community learn how to use it and get online and use it for purposes that the community needed. So for instance, in Brooklyn, when Hurricane Sandy hit, the neighborhood that had the digital stewards was really hard hit. I mean, really bad flooding, lots of public housing in the neighborhood. But because they had digital stewards, because they had their Wi-Fi network stayed up. So it's how they were able to stay in touch with one another. It was how they were able to share what government services were available to help people if their apartments were flooded. It was where and how they found each other. It was just an amazing example. But the other part of that example that I love so much is digital stewards are significantly more likely to go to college. That's not about whether they become techies. It's about the empowerment that helped them be motivated and see opportunities for themselves that led them to higher education. So you get this sense of all of the benefits, right, that come from community, and that social determinants of health, which is how do we think about the assets of a community is also its people and its young people. So that's just a great example. But I also think, I'm really impressed by a student movement now on artificial intelligence, where there are college students now that have created their own organization to demand an end to surveillance, to demand civil rights protections, to demand that they be kept safer online. And I think that's really inspiring too. And then, of course, I already talked some about what we're seeing in communities and cities where cities are really, and states have really been trying to innovate. How do we get more service to our people? How do we find different ways to get that service and not only be beholden to companies?
I love that example on digital stewards. And that's exactly, it just kind of helps kind of pull together sort of the intersections of this, this cross-disciplinary work that we, are all a part of. I know you did a lot of work under working with the city of New York with DeBlasio. And I know one of sort of just the interesting conversations I heard you mentioning was looking at some of old infrastructure and how you change old infrastructure and make it applicable to so this new environment. One example is the phone booth, which I don't know when the last time I've actually seen a phone booth, but maybe you can talk a little bit about that.
Yeah. So the idea of this, and I always get a lot of credit for it, although really it was a lot of people, and it even started in the Bloomberg administration said, if we could, nobody's using these telephone booth, anymore, because even low income people, as we said, now have smartphones, and they were vandalized and getting into disrepair. But the city, it was a franchise of the cities, meaning city didn't own the actual telephone booths. But city licensed the sidewalks for those booths to be put up. And so when those franchises were up, the city just said, okay, we're gonna put out to bid creating Wi-Fi hotspots rather than telephone booths. But all the telephone companies that own them could, bid. But so it went, but that's the bottom line, was the city using the power of its contracting to say, let's do something new and make it free. So the people who bid had to have a financial model, which was ads, so that did mean they were going to have these screens that would run ads, because that was going to pay for the service so that everybody else could get the service for free, be able to get online for free. And you could still make phone calls. It was just tablet phone, it was just voice over internet phone calls instead of that old fashioned. But you could also plug in your phone, use your own phone if you needed to juice up. It had all those things. And, it was just an example. Boston did benches. Boston made these like wireless benches where you could plug in and get a Wi-Fi link. Some folks, there's this technology actually that other countries are using that we should, which makes public buses internet hotspots. So we really have and even in the subway. So we really actually have the ability technologically to create a lot of public access points. And our vision was, I wasn't there long enough, and no one administration can be there long enough for this vision. Everyone has to carry the vision. But think of the internet, think of the infrastructure as a net, and a net over a geographic area. And, you could literally have all these nodes, all these towers, all these places and then you could link those, and then you would just have a net that covered the city. And there is no reason technologically, it's a big radical vision, but there's no reason why we couldn't technologically accomplish something like that. It's more about will and regulation and policy, but that's the way we have to think. We have to start thinking very differently about what it means to have access and what our assets are. Our people, our communities, our buildings, our poles, all the things that enable us to use the technology to increase access and create a big net.
Yeah, and that's an important comment, because we're close to Silicon Valley, and it's still remarkable to me. There are not a lot of public hotspots. Not even in San Jose, which is where right in the middle of Silicon Valley. I know there are a few buses that have internet hotspots, but to me, like you would imagine you'd want everyone, like we want everyone to have education, because that makes us a better society. You would want to figure out a way for technology, corporations, and the government to work together to ensure that, like water, even though we are paying for water, my water bill was very high last month, by the way. So, it's like nothing is, these essential elements to our existence that's something that as healthcare professionals, public health professionals, we need to continue to advocate and fight for. As you mentioned in the beginning, we have to disrupt the fact that water is not free.
Yeah, I'm worried about what they'll do with air. I mean, but to your point, I mean, technology is critical to address climate change, but is it going to be an inclusive technology and inclusive climate change benefits, or is it going to become one of privilege? But climate change and the technological and climate justice all do require that we do this technology differently, and the communities can innovate.
Wrap back around to one of the comments you made that just really stuck with me when you were doing the overview of social determinants and all the, the bubbles that were there, and how so many of them are interrelated, and how technology is just kind of a thread through all of them. It's just really layered. And one of the things that really struck me was when you mentioned how so many hospitals were closing in low-income areas. And, I live in an area in Richmond, California, where there are a couple of hospitals that closed. I'm fortunate enough to be able to, go to another local hospital, but one that's smack dab in the middle of a community of color closed. And, I don't think about it often, but it made me think about how do people access services? And one of the things that I've repeatedly heard is that now people have greater access through technologies, through this telehealth mechanism. And what has dawned on me is that it seems as though perhaps the advent and usage and proliferation of the usage of telehealth has actually created an even wider gap. And I wonder if you could speak to that a little bit, and how we can address this new telehealth gap that is really emerging.
Yeah, that's such an important point. And I actually did have this point in my notes as well. So I'm so glad you raised it. I mean, first of all, I think telehealth can be very useful, right? It's like all things, it's not all a negative. But if we're really honest, one of the reasons we're talking about telehealth so often, particularly for communities of color, is because communities of color don't have the infrastructure that we need. If you don't have hospitals, if you don't have doctors, we actually were trying to, in your community, because we also have the issue of not having a sufficient number of primary care doctors in a lot of low-income communities, rural and urban, right? It's a rural and an urban problem. And so telehealth becomes a solution in the sense that it's better to have that than nothing. But really, what do you want? Right? I mean, because if you're higher income like I am, I can do some telehealth if I want to, but I can go in and see a doctor. I can go to a hospital. I have all the ways to access the points of access. I have choices. If what we're doing is using technology as a way to provide something less good for people who don't have that they need, then it's going to be better than nothing, but it's still going to be unequal. It's still going to be a problem. And we've actually seen, and we saw this through COVID, we literally saw the racial disparities in who accessed telemedicine, because the other assumption in that is that people will. that it won't be alienated enough. And there's some good research on telemedicine reducing some bias in the experience of people of color in healthcare. And there's some that show that, you're more likely to use it if you're young, 18 to 34. If you're a person of color, you're less likely to use it if you're older. So there is a question of, will our senior citizens use it? Because they're using it at much lower rates. And then there's, because this is also interesting to me through COVID, because there was a study done that showed Asian and Latinos were more likely to have a telehealth visit than people who were white or Black. So we do see behavioral differences in who is willing to utilize telehealth. That could be for a number of reasons. I don't think we have enough research to show, but we make an assumption, that we should settle for something that it's certainly good to have telehealth options. But if what we're really saying is we're going to create health equity by giving people something that is only part of what they need, then we're just reinforcing inequity. We're not solving the problem. We're putting a Band-Aid on it when we need surgery. And then we're not paying attention to, well, who will utilize it, why, and how? Because we forget people are people. People have experiences, and we shouldn't make the assumption that if you bring it, they will come. If you build it, they will come. It's if it has value to them and they know how to use it and they don't have negative experiences with it, they will maybe. And then what's not appropriate to use telehealth for?
No, that's so correct. And I see that one of the members of our community just stated that, telehealth doesn't work for so many people. And it also doesn't work for every ailment, right? I think what we don't realize is that there's a lot in body language and face-to-face communication that just does not come across a screen. And we need to be aware of that, and kind of even the issues of cultural competency and how people are need to communicate. So I do really appreciate you touching on that, because that is something that our students are grappling with, and whether or not they are going to provide care via telehealth, when to provide care via telehealth, and how to really have a voice in it. And, as far as our public health students, how are they going to interact with kind of the system to either disrupt it or guide it? And I think that's the message that has come across, that the system needs a lot of guidance so that we can better care for our population and our communities of color. So I want to thank you for being with us this evening and really enlightening us as to what we can do, kind of examples of the digital divide, examples of innovative solutions to encourage us. And I really appreciate your time this evening.
Well, thank you. I enjoyed it. I have been watching. Thank you all in the chat, both for sharing your experiences and your thoughts, and for everyone for your time. I hope, while I've talked a lot about the critique, I hope you all know that you absolutely have every ability to make true differences for people in their lives, including, like with this last question, just being sensitive to what do people need? How do they get what they need? And who's not going to get it if we don't do it the right way? And that's exactly the power of the better question. So thank you.
You all have a good evening. I'd like to remind our participants that we are rescheduling session 3. Please look at our webinar site for more information. Thank you again, Ms. Wiley, and have a good evening.
Thank you. Be safe and well.
Same to you.